Okay, let's get into this. Welcome to the Deep Dive. We're the show where we really take source material apart, find the core stuff, and pull out those key insights, well, just for you. Today we're focusing on something quite specific. It's a resource that's aimed squarely at medical students who are just starting out in, the very complex field of orthopedics.
Right, and the source material we're digging into today, it's basically descriptions of a book. It's called 100 Questions and Answers in Orthopedics for Medical Students, and the author is Dr. Atef Ahmed.
Okay, so our mission for this particular deep dive, and we're only using these descriptions, remember, is to really understand why this book is presented as, well, such a vital tool if you're aiming for orthopedics. And importantly, what the key benefits might actually be for you, the learner, as you process this kind of information.
Exactly. And maybe the first place to start to understand its potential value is looking at who wrote it. The descriptions name Dr. Atef Ahmed as the author.
Yeah, and the source material really makes a point about his background, doesn't it? What do they
Yeah.
emphasize there?
Well, they position him as an expert in medical education, first off. But also, they describe him as a, renowned surgeon and an educator with decades of clinical experience, plus the teaching expertise.
Decades of both, clinical work and teaching. That combination, well, this feels pretty important, especially for orthopedics. Why would that specific background be so valuable for a book aimed at med students in this field?
Well, think about what students face in ortho, right? You've got really complex anatomy, biomechanics, trauma, chronic stuff.
Mhm.
It's a field where the theory in the book can feel, well, worlds apart from the clinic or the OR.
Yeah, definitely.
So the description suggests Dr. Ahmed's background is key precisely because it lets him bridge that gap, bridge the textbook knowledge and the actual real-world clinical practice. He's not just like listing facts. He's connecting them to how things really work with patients. And that's often a huge jump for students.
Ah, okay. So it's about making that leap from just knowing the stuff to knowing how to use the stuff. That bridge.
Yeah. Yeah, that's often the tricky part. Now, the title itself, 100 Questions and Answers, kind of gives away the structure, doesn't it?
It really does. And the descriptions definitely focus on this format. It's structured exactly like that. 100 questions, each followed by its answer. And the sources explain why they think this specific way of doing it works so well.
Okay, and according to those descriptions, what's the logic? Why the Q&A?
They say it's designed to, quote, enhance learning and retention. Makes sense. But maybe more interestingly, they also point out that this format actually mimics clinical problem solving.
Oh.
Yeah, which in turn they say enhances critical thinking skills.
But that's really interesting. So it's not just about passively absorbing info. It's structuring it to like train your brain to think like a clinician,
Hmm.
tackling a problem, finding the answer, turns reading into something more active.
Exactly. Active engagement.
So what about the scope? What ground does it actually cover within those 100 questions? The material we have describes the content as comprehensive coverage, pretty broad. It apparently spans from fundamental concepts, the basics, maybe bone healing or something, all the way to recent advancements like new techniques or treatments. And, crucially, it includes practical case studies to show how it all applies.
Okay.
So it seems to aim for breadth, covering the essentials, but also how the field is evolving, all grounded in, real-world stuff.
Right. Comprehensive scope, but delivered in this learn by doing kind of structure and guided by someone who gets both the theory and the messy side of practice. You can see why the source descriptions are positioning this as a, quote, must-have for medical students.
Precisely, and they explicitly call it student-centric. It's really tailored for that audience.
So what does student-centric mean it actually tries to do for students, according to these descriptions?
Well, the sources say it's designed to prepare readers not just for exams, though it does that too, but for their future roles as healthcare professionals. So the focus is broader than just acing a test.
Right? Building that foundation for a career.
Right.
That totally aligns with needing to understand, not just memorize.
Uh-huh.
The descriptions also list some specific benefits that, well, they sound pretty good.
Yeah, they really emphasize clear, concise explanations, making complex ortho stuff approachable, apparently for all learning levels. It's described as ideal for both targeted exam preparation and for just solidifying a foundation in the field generally.
Mhm.
And the claim is that it helps students get more than just, facts by rote. It helps gain a nuanced understanding of conditions and how you manage them.
Clear, concise, nuanced understanding.
Yeah, those words definitely sound like they're aimed at cutting through the usual information overload in med school texts, helping you build a knowledge base that's solid and actually usable. The descriptions use some pretty strong language too, like calling it an invaluable tool, even a cornerstone for a student's library. Yeah, they really position it as more than just a one-off study aid. The descriptions actually call it an investment in your future, suggesting it's a guide you'd keep coming back to, referring to it throughout your studies and early clinical practice.
Wow. Okay. So not just for the exam, but a longer-term companion. So let's tie this all back to you, the listener, the learner we're doing this deep dive
Yeah.
for. We've heard how the book is described. Q&A format for clinical thinking, expert author bridging theory and practice, clear explanations, comprehensive scope.
So how do these features, when you put them all together, how do they really address the needs of someone trying to get a handle on a tough field like orthopedics? Someone who needs it quickly but also thoroughly, needs structure, memorable details, and doesn't want to feel totally overwhelmed.
Well, it feels like the approach they describe creates a kind of learning feedback loop almost. The Q&A breaks this huge subject down into manageable, problem-sized pieces.
Right.
The expert author's input ensures the answers aren't just dry facts, but have that vital connection to clinical reality that makes them more memorable, more practical.
Mm-hmm.
And by aiming for clarity and conciseness, the book, as described anyway, seems built to make these complex topics accessible, directly fighting that overwhelm factor.
Exactly. And I think the real insight here isn't just that it has these features, it's the combination. An expert who bridges theory and practice using a format that simulates problem solving. It seems designed to actively train how you think, not just what you know. It's presented as a tool for applied understanding.
Yeah, it sounds less like a static book you just read and more like a dynamic guide for, well, active learning.
Which brings us nicely to a final thought, just based on digging into this source material about the book. Consider this, how effective learning tools like the structured Q&A format they describe for orthopedics, they aren't just passively giving you information. By mimicking real challenges, by providing expert insights in a way that's easy to grasp, they can actually shape not just what you learn, but fundamentally how you approach problems and think critically, especially in a field as demanding, as complex as medicine, something to think about.